Hello, my name's Emily. I'm a junior doctor with the NHS and I'm a mum of two. I'm here today with Jo Neville, who's a health visitor, and we're going to have a quick chat about the role of a health visitor and how they can support new mums, especially during the pandemic. So Jo, I wondered if we could start off by you telling me what a health visitor is and how they can help support families.
So health visitors, we are trained nurses or midwives, and we support families, so mothers who are pregnant antenatally and children from birth till the age of 5 before they go to school, and for mothers and fathers and all families' emotional health.
I think what I found when I had my children is that you sort of expect that all these answers are going to come to you as an instinct. You know, I'm going to know how to breastfeed, I'm going to know when to wean and how to do it and how to encourage them to sleep, and it kind of becomes obvious quite quickly that those things don't all come naturally and you do have to get help. And I do remember my health visitor being a real wealth of information for me.
Certainly for first-time parents, that transition to parenthood is a huge step.
So Jo, can you tell me what support is available for parents of children under the age of 5 via their health visitor?
I would ask parents to call us on the advice line. No question is a silly question, so please, we're there to support you. We have our website, lots of information on there.
And in terms of face-to-face home visits, are those still happening through the pandemic?
During COVID, particularly people haven't been aware that we are offering lots of face-to-face contacts should they need them. So we're offering everybody a new birth visit. So when mums have had their baby, we visit between 10 to 14 days postnatally. That first visit where we can just see how mums are coping, how families, how dads are coping. Is feeding going well? Are babies putting weight on? Are babies developing as they should be? And giving that support and reassurance to parents. And we also see people face to face in clinics. Our clinics are booked clinics at the moment, so we're making sure during COVID that they are safe. And we also are using virtual platforms as well for support groups and for development reviews.
I didn't know about the advice line, so that's a really good thing to kind of point out. And I think had I been aware of an advice line, I think I definitely would have used it when my kids were little. So it's really nice to know. Perhaps I think in those early weeks going out the house can sometimes be a bit nerve-wracking, or you know, for lots of different reasons, sometimes it's easier to just pick up the phone.
I'd rather be able to tell somebody that it's absolutely fine than they'd be laying awake at night at 3 o'clock in the morning and worrying. Just that bit of reassurance, then absolutely, that's what we're here for.